Tepezza is a prescription medicine used to treat TED, no matter if you've had TED for months or years. Tepezza may cause infusion reactions. Tell your doctor right away if you have high blood pressure, fast heartbeat, redness of the face or feeling hot, difficulty breathing, headache, or muscle pain. Please stay tuned for additional important safety information later in this video.
What it meant to me to have the treatment option of Tepezza is it made me grateful. I was so grateful there was a treatment that could potentially make my thyroid eye disease better.
It meant a lot to me to finish my treatment. So after completing a full course of Tepezza, I looked and felt more like myself again. Since completing treatment, my life with TED has been a lot different. I could make a lot of decisions without second guessing or thinking about my eyes.
At the worst of my thyroid eye disease, I avoided cameras at all cost. I didn't like the way I looked. It was hard to look at myself in the mirror. I feel like I'm okay looking at myself in the mirror now.
Over the last 5 years, I've found that there's been a meaningful impact with Tepezza treatment on TED symptoms for the majority of my patients.
Tepezza is one more medication that I have in my arsenal to bring good quality of care to my patients. What motivates me to continue to treat patients with thyroid eye disease is the majority of my patients benefit from it.
The beautiful thing about treating a patient with thyroid eye disease that I see now treating patients is that I actually have other options. I have Tepezza. It's an impactful treatment.
Tepezza has really become another tool in the toolkit for managing patients with thyroid eye disease.
Going through TED, thyroid eye disease, for 25 years, I just learned to live with it. When I went to that oculoplastic surgeon, she said, "Kim, instead of doing a 5th surgery on your eyes, I think we need to try this new medicine called Tepezza." After the complete treatment, my eyes went down 3 millimeters in each eye.
After I completed my 8 infusions, I noticed that the proptosis that I had improved, and also the double vision that I was experiencing.
I did experience fatigue and the nausea. Over the course of those treatments, they did improve.
Tepezza has become my first-line choice of treatment for TED.
She was one of my initial patients who I diagnosed with thyroid eye disease and went through this whole treatment journey. So really just being able to see her treatment journey and her after treatment journey with thyroid eye disease and with Tepezza, this is what motivates me when I see another patient that's suffering, and maybe even suffering in silence, maybe not even complaining about thyroid eye disease, thinking that this is something that's normal.
Since I finished all 8 infusions, I felt like I could look at myself in the mirror again. I see me again. Someone who's grateful to have received Tepezza, someone who's excited about the future, someone who's not afraid to look people in the eye anymore.
Important safety information. What is the most important information I should know about Tepezza? Infusion reactions can happen during or within 24 hours after your infusion of Tepezza. If you have a reaction while receiving Tepezza, your doctor or nurse will slow or stop your infusion and treat your reaction. If you have a severe infusion reaction, your doctor may stop your treatment completely. Tell your doctor or nurse right away if you have any of these symptoms during or after your treatment with Tepezza: high blood pressure, difficulty breathing, fast heartbeat, headache, redness of the face, feeling hot, muscle pain. Tepezza may worsen inflammatory bowel disease, IBD, such as Crohn's disease or ulcerative colitis, even if you don't have a diagnosis of IBD before starting Tepezza treatment. Tell your doctor right away if you have worsening IBD symptoms, which may include diarrhea with stomach pain or cramps, blood in your stools, sudden urgency to have a bowel movement, or feeling like you need to have a bowel movement even when there's little or no stool to pass. Tepezza may cause an increase in your blood sugar, Before starting treatment with Tepezza, tell your doctor if you are currently being treated for diabetes, know your blood sugar is high, or have been diagnosed with diabetes. It is important for you to take your treatments and follow an appropriate diet for glucose control as prescribed by your doctor. Tepezza may cause severe hearing problems, including hearing loss, which in some cases may be permanent. Tell your doctor if you have any signs or symptoms of hearing problems or changes in hearing. Before receiving Tepezza, tell your doctor if you have inflammatory bowel disease, Crohn's disease, or ulcerative colitis, are currently being treated for diabetes, have been diagnosed with diabetes, or know your blood sugar is high, are pregnant or plan to become pregnant. Tepezza may harm your unborn baby. Tell your doctor if you become pregnant or suspect you are pregnant during treatment with Tepezza. Women who are able to become pregnant should use an effective form of birth control, contraception, prior to starting treatment, during treatment, and for at least 6 months after the final dose of Tepezza. Are breastfeeding or plan to breastfeed? It is not known if Tepezza passes into your breast milk. Talk to your doctor about the best ways to feed your baby during treatment with Tepezza. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, dietary, and herbal supplements. Know the medicines you take. Keep a list of them to show your doctor and pharmacist when you get a new medicine. What are the possible side effects of Tepezza? The most common side effects of Tepezza include muscle cramps or spasms, nausea, hair loss, diarrhea, feeling tired, high blood sugar, hearing problems, taste changes, headache, dry skin, ear discomfort, weight loss, nail problems, and changes in menstruation. This is not a complete list of all possible side effects. Tell your doctor or treatment team about any side effect you may have. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information or visit Tepezza.com for more information.